want to appreciate the folks who came here on time to join us. We've got a nice group. We have a great webinar. So glad to be together again. I think a fair number of you joined us 2 weeks ago when we introduced our community of practice, our career community, as we like to call it. So we won't go into great detail about that. I want to let you all know that we are going to keep you on mute. Hope you stay on mute. If you have questions, please enter them in the chat box. And if we have time at the end, we will open up and unmute people for questions. We are recording this webinar, so just so you know that's happening. And that's some of the business. As we get started, we'll each introduce ourselves and tell our roles. We are the Upwardly Global Healthcare Community of Practice. I'm Tamara Frolickstein-Appel. I am the lead of this group. I've been a career coach at UpGlo for about 7 years and have worked with healthcare professionals the whole time. And I'm really excited to see this movement in the way that we're working. I want to tell you what we're doing as far as a community of practice. There's some real details. We are diving in on professional journeys and career pathways. So today's webinar is the first in a series. This one is for our public and global health pathway. We know many of our healthcare professionals come with experience in public health and global health, expertise in managing through crisis, pandemic spread, all sorts of things that are very important today. We wanted to drill in and be a little more specific about our career advice for you. We also, as you know, have started a Slack community. We really hoping many job seekers will join. It is a way for us to share information with you very efficiently and hopefully for you to communicate with each other. For those of you who have joined, feel free to comment on each other's comments and questions and share information. We really want this to be a positive, supportive community. So also feel free to offer advice and suggestions. We're going to continue to add various channels as we move on. And if you have questions, as always, reach out to your career coach. We're also going to do a deeper dive on skilling in the healthcare world. We'll start today, talk about a little bit about opportunities for adding to your skills in the global and public health world. We're going to put a big emphasis on helping you build your professional networks, utilizing our employer partners and our mentors, and continue to do events and use industry research to inform and market research to inform our work. Here's our agenda today. We're going to talk, I'm going to give a little overview, what and why global and public health, talk about some of the roles and job titles, important skills, certifications, and training. Kayla, who is our partnership and volunteer lead, is going to talk a little bit about the importance of networking. We're going to just quickly talk about a few companies and employer partners. We have a wonderful alum, Sadiq, who's going to share his story, and then have time for question and answers, and talk a little bit about next steps using the Slack and going from there. So thank you all once again for being here, and feel free to put your questions into the chat box. So why are we starting with public health? Public health and global health, we feel, are very great pathways for our job seekers. Public health has been defined as the science and art of preventing disease, prolonging life and improving quality of life through organized efforts and informed choices of society, organizations, communities, and individuals. We know our healthcare professionals at Upwardly Global have expertise in this area. Um, as you come as immigrants and refugees, you have international experience. And we have been starting to really drill down and identify opportunities in global public health. But we also know for many of you who are located outside of DC and New York, um, there are fewer opportunities, and your experience is also in direct service. So we've combined global and public health because much of the work is very similar. It depends on the context. Are you consulting and working on issues outside of the US, or are you working directly in the public health arena inside the US? So we want to figure out ways to help you build on your expertise and experience. This field is one of the areas in healthcare that's less regulated. So we think it's a great opportunity. And employers are looking for your experience. They're looking for your international expertise, your knowledge, your language skills. So we think this is really the place to be. And I'm going to pass it to my colleague, Patty, to introduce herself and talk a little bit about some of the roles and job titles.
Hi, thank you so much, Tamara. That was a wonderful start. I also want to welcome everyone joining today and those who joined already last time. Thanks for coming back again. For those who don't know me, I'm Patricia. I work at the DMV office, usually, in the DMV region. I work with healthcare job seekers for already 2 years. I'm not as long as Tamar in this expertise, but I really enjoy working with you all because you have such an amazing background and talented, skilled professionals. So yeah, I think that's a little bit about myself. About today presentation. So this slide shows you a lot of titles and roles, and I don't want to go over them in detail because you probably can talk about them even better than I do. I'm not an expert as you are, but this is to show you like public and global health. And as Tamar already said, that we combine both, although some of you guys are more interested in public or global health. But if public health skills are transferable into global health. So that's why today, when I speak about public global health, I usually mean both. Here's some roles that you might be already aware or not, and if not, just we will send out the deck so you have those titles as well to research, but just keep those in mind when you apply for jobs, when you tailor your resume, because there's a lot of jobs and roles you might not be aware, and as we know, there are too many job titles here in the US. So epidemiologist, number one right now, contact tracer as well, coordinator, evaluator, technical advisor, everything that's technical, consultant, assistant. And then you can specialize on malaria, HIV, reproductive health, technical research consultant, clinical service manager, program manager, officer, everything with program. Policy and program advisor. So if you work with programs, implementation, monitoring, evaluation, these are important skills. So target those roles when you apply for jobs. And I know it sounds easier than it might be, but the key is to find like websites where you can, and there's one website that I implement those, that I add on the slide. If we can just quickly open up the website. It's a public health org. It's a wonderful website that maybe some of you guys are already familiar. If not, I will just very briefly go over. So it's a website that you, public and global health combined. And if we go down a little bit to the categories, excellent. So I would focus on the careers available. And there you can see different categories and occupations. So biostatistics, informatics, communication, public health, emergency management, epidemiology, etc., and global health in the end. So if we can click maybe on global health, for instance, just very briefly. Perfect. Or just as a side note, I would ignore the search colleges, because this is I would focus more on like what the information about this particular occupation is. Like if you just started your job search in public health, or if you need more information, what's outside there. So go down please a little bit. Working in global health, so it shows you the education in global health, work experience, what's required, what's common, and then certification. Even I really like that because it shows the certification. You, if we go down a little bit to, yeah, I think the certification went down. Just play around with this website, association, main responsibilities. So I don't want to spend too much time on that, but this is a website where that we will share on Slack afterwards. So one more reason for you all to sign up in Slack so you can access it. Next slide, please. So important skills. So this is also only an overview. I'm not going into detail into the skills that are important for public global health. And I also forgot to mention nonprofit international development, because some of you might not be even interested in or might be especially interested in working for nonprofit or international development organizations. So we combine those two. So important skills we categorized in technical knowledge, international experience, soft skills. Next slide, please. So this is technical knowledge, and this is just from the experience that I have with working with job seekers in public global health. Only very like a snapshot of what you all have for experience. But these are important for your field. So let's, I know some of you, or a lot of you, already focusing on public health, global health, are applying. So you already have your resume, your profile tailored. Some others might be on the traditional career pathway, trying to get back into residency, being relicensed in the US, and are interested in public health, but completely new. And these are skills that that you may have, but you're not aware. So ask yourself, like, did I monitor and evaluate any programs? Have I been working with HIV-related programs, projects, implementation of different infection disease healthcare programs, reproductive health as well? Have I provided any researching, learning, training to universities, employers, companies, staff? Capacity building. Did I do any grants development, implementation, collaboration with donors and other international agencies? Data analytics, data science, also very important skill. So if you have some interest, data analytics, data science, or even you have this experience already and skills, put them in your resume and apply for roles that are that need those skills in healthcare and public health. And of course, the most common infection disease controls: malaria, HIV, tuberculosis. And then the other one that I want to point out, community health. So as I said, these are just examples for technical skills that I relate to your field and that are important to implement when you apply to utilize. So next slide, please. International experience, very important. Tamara already mentioned the importance of international experience in public global health, that especially you as foreign trained professionals, that you already work with different organizations like the World Health Organization, and I don't even know a lot of those, but UNICEF, USAID, FHI 360, I know there is some job seekers as well who have already experienced. They are needed here in the US. So target those organizations, or target organization, nonprofit international development organization that are looking for candidates that have been working with those companies. And I will, in a few minutes, I will point out a few companies as well that are in this area, in this experience. Work and living experience in underdeveloped countries. I can say that from my experience working with job seekers applying for global health, but sometimes even public health, or often, that preferred skills or even sometimes requirements are at least a few years living and working in underdeveloped countries, or in specific countries that are exposed to specific health issues, public and global concerns. And of course, your language skills. So utilize, point this out when you apply, use this as one of your bonus points. I always say when I talk with my job seekers, point this out that you have those skills as bonus skills. So don't underestimate the skills, because there are professionals out there that are applying for those jobs. They don't have those international experience. So you stand out with those. Okay, next slide, please. Soft skills. A lot of professionals, and this is regardless in which industry, underestimate the soft skills that you bring to the table, that you gained through your experience, and especially as healthcare professionals, you have worked in different circumstances, different patients, or different individuals, different partners, stakeholders. All of them are gained through all of this. You gained important skills that you need to utilize when you apply for opportunities in this sector. And there are a few that I came across that are mentioned a lot of times as critical for the global public health sector. Communication, because you need to be able to, when you work on public global health programs, you need to be able to communicate issues, concerns, present this to employers, to staff, to different levels, to the public. So communication is very important. Leadership, if you had any leadership experience, staff management, leadership in program project management, execution, implementation, all of this important. Point this out in your resume and in interviews. Collaboration, teamwork, remain skill as well. Interpersonal skills, empathy, intercultural, or cultural understanding throughout your international experience that you gained is important. Problem solving, of course, thinking out of the box when you work on different issues, concerns related to public global health. Yeah, don't forget attention to detail, of course, every time different, and flexibility. This is one of the main soft skills and abilities as well, to be able to adjust to different environments, but also to different, we see it right now, what's going on in the world, being able to adjust to different health concerns and provide problem solving and solutions, problem solve related solutions. All right, next slide, please. I wanted to briefly emphasize, so I just talked about a lot of skills and experience and roles, and it's a lot of information, especially those who are still following the traditional way of trying to get back into residency or working in a clinical clinical hospital environment. So if we can just look at click on the sample. So this is just an example of a resume of a job seeker that I worked, and I received kindly his approval to share it today during the webinar. If we could just look first, let's start at the his education. So this is a public health education. Let me just focus job seeker who, when you look, has a doctor. So he has a doctor in medicine. So he's a doctor focused later on medical science and health economics and pharma economics. Let's let's start where he started his career. So he started as a physician, actually, with already project management experience. And I'm not reading his experience responsibilities, it's way too long, but just to emphasize, if you have any experience in that you did not that you're not aware of, that actually those could be important for you to transfer into the public global health fields, then sit down with your advisor and try to explain what you have done. Oh, yes, maybe there is actually a project that you managed monitoring evaluation, and you have monitoring evaluation skills, and you have actually done a lot. So this is how you tailor your experience to pursue also a different pathway. And then we go a little bit up. So you can see his development from physician to laboratory science, health economics, and research. And then the key skills section, and this is the foundation resume, so he keeps tailoring the resume. It looks like a lot right now, but these are the key skills that he has pointed out on his foundation resume: health economics, outcome research, project program management, monitoring evaluation, public global health, all of the different areas he has worked in public health. We can see HIV, infection disease, malaria, and I know a lot of you have worked with programs in this in infection disease control, healthcare management, team leadership, technical assisted capacity building, soft skills as well. So try to this is my advice that I give to job seekers, to especially who are pursuing different pathways, to create 2 or 3 resumes that are tailored with different that highlight different skill sets and experience. So you have this, and when you don't need to struggle as much when you apply for jobs for different pathways. That's just a brief example of I hope this was helpful. And yeah, if not, you can reach out to me if you have any questions about that. Okay, and then there we go. So certification and training. And I don't want to get too much into this because we will post all of that on Slack. But this is just to let you know that there are trainings and certification. And we at UpGlo, we also are continuing our research on them. So if there's any training that you took and you thought it's helpful in public global health, please reach out to us so we can also add it to our resource bank. But these are some. Leila, would you like to mention the 2? Would you like to talk about the first two?
Absolutely.
Thank you.
So hi, everyone. Some of you know me, some of you may not. I'm also a job advisor, just like Patty and Tamar, and I work specifically with job seekers in healthcare, and I'm based out of the San Francisco office, which serves California and Washington State. So as Patty mentioned, I wanted to talk about the first 2 that are mentioned here on this list. And as it says here, these are also posted on Slack already. We'll talk more about Slack later and how you can join if you haven't joined Slack, but community health worker certification. So some of you may be familiar with community health worker, and there is a certification that exists for it. But just to give you a sense, a community health worker is someone who works with the local healthcare system in both urban or rural environments. And usually companies or organizations or government agencies like to hire community health workers that are multilingual, that kind of share the ethnicity, socioeconomic status, or life experiences of the community members they serve, which is why it can be such a great fit for immigrant or refugee communities, especially if you live next to a pocket of people in maybe a grouping of your community. There are a lot of different job titles for this area. Some include, of course, community health worker, community health advisor, a health advocate, promotores, outreach educators, community health representatives, peer health promoters, or even peer health educators. So you may be asking, what do they do? So a lot of it is interpretation and translation services, direct kind of service, interacting with community members to provide them with health education information, counseling, or guidance. And so for the certification, not all jobs require the certification. Some may hire you and then will allow you to get the certification once you start. But it can be helpful to take courses. I'd say look at your local community college to look for some community health worker courses if you're interested. And the next one is contact tracer certification. So with the outbreak of this pandemic of COVID-19, community tracer or tracing jobs, as you may have heard already from your advisor, is something that have been kind of exploding. There have been hundreds of jobs out there throughout the US. And what contact tracers really do are they try to reach out to those who are infected or may have been exposed to try to understand who they came into contact with and really map that out. There's a certification that you as an UpGlo job seeker can access for free through Coursera, and reach out to your advisor if you want to learn more. It's through Johns Hopkins. It's called the Contact Tracer Certification. So you can easily find that on Coursera and then add it to your resume once you get that, if you're interested in these jobs. And back over to you, Patty.
Awesome. Yes. So thank you so much, Leila. Other certification and training opportunities is if you're interested in health education, there's one called Certified Health Education Specialist. We don't need to go into this in depth and to be mindful of the time, but this is one option. Then if you have worked with program implementation, monitoring, evaluation, there is one specific that was recommended through a volunteer in a recent webinar. It's within the relief and international development sector. So also those who are interested in international development it might be beneficial for those to take a look at that. The other one is, and I know some of you might be familiar, I think most with the PMP, project management. There is one similar called PMD for specific specialized in international development professionals. So this might be also helpful if you would like to utilize your skills in international development in project management. And for more, I would recommend the website I showed in the beginning, publichealth.org. We don't need to take a look at this. Everything will be shared afterwards, so no need to take notes right now, unless you want to. Next. Yes, thank you.
Hi, everybody. My name is Kayla Stevenson. I'm the Partnership and Volunteer Program Lead at Upwardly Global and also part of the healthcare team. And I really wanted to emphasize and talk about the importance of networking, whether it's for global and public health or any field. I personally do think that in the nonprofit sector or international development, networking can be a really important key to helping you find the job that you're looking for or to enter the type of company or organization or hospital or healthcare system that you're hoping to work for. So a few key factors I want to talk about today is first, LinkedIn. You're going to hear us talk about LinkedIn all the time. And if you haven't yet made a LinkedIn profile or don't use it often, I would really encourage you to get on LinkedIn and make or update your profile. The stronger the profile, the better, because with the more information that you have, the more about yourself in a photo is really going to make you look more of like a real person, right? Instead of just this random profile on this random website, to have a photo of yourself, to have all these details, you can really then let recruiters or anyone on LinkedIn really see and know who you are. Make sure that when you do have a photo, that it's nice and clear, it is not heavily pixelated or blurry. A smile always goes a long way too. And then there's always the and then at the bottom of the profile picture, that's usually when the bio would be. And this bio is just a short sentences about your experience, kind of what you put at the top of your resume, right? You can say 10 years of professional work experience in blank, experience in A, B, or C, and really kind of just put your top key traits in that bio. Then also have your most recent previous work experience, or even the past 3 work experiences, anything that you feel is very relevant to professional job search will be really important to also have on that LinkedIn. And then with LinkedIn and having a strong profile, you will get more matches. It is really it's strategic, and it's been proven that with a strong photo and a strong profile, you're more likely to have recruiters look at you and make more connections. So I would really encourage looking at LinkedIn. And if you are nervous about connecting with people on LinkedIn or sending messages to people you don't know, then I would really emphasize practicing on Slack. You keep hearing us talk about Slack, but it's because we created this platform specifically with all of you in mind to connect with job seekers and with us, staff. So this is a way for you to network amongst the other job seekers, other professionals that you haven't met yet that you can meet in our virtual Slack community. And this is a safer space than if you want to ask more questions or try to get more information, or this is a way for you to even practice your virtual networking by putting in maybe an article you found or asking a question to the larger group within Slack. Maybe this can kind of warm you up to then starting to do that on LinkedIn. And then I also wanted to talk about communication and what it means, and if you are making connections, whether it's on LinkedIn or Slack. So 2 big pieces about communication, whether it's a professional relationship or any relationship, is you have to stay in communication, right? And 2 of those is reaching out, but also following up. So for example, even if I or someone at Upperly Global introduces you to a volunteer, or if you get introduced to someone virtually, it's always important to reach out and show that you're interested in meeting that person. Say, thank you for your time. I'm interested in connecting with you. And then when you do connect with them, it's so critical and important to also follow up. Because if you don't follow up, even if you're nervous or if you're scared to follow up, if you don't, then they didn't think you really wanted to stay in contact with them, right? If you're silent, then they're going to think, oh, maybe they didn't want my help. But if you are following up with your volunteers or anyone that you're in contact with, they're more likely to then also be following up with you. And that's how you build those strong communication and relationships. It's just by having to kind of put the practice into it, and by doing the follow-up and doing the reaching out. It's never going to be 100% success. There's nothing in life that's 100% success, but the more you do with practicing, the better you'll get at it. And that's just another great way with building your network. As Patty and Layla were saying too, that I took some notes about those soft skills that Patty was talking about, being interpersonal, building relationships. If you want to develop those soft skills, how do you do that? By communication, by practicing your networking, right? And so then you can feel more confident saying you have interpersonal relation building skills on your resume, and you can even demonstrate that through your networking ability. And then also search for professional organizations. They can be professional organizations within your city or within your state, or within the certain type of profession that you are, whether that's public health or global health or what specifically you're looking to do. And if you're not quite sure where to find these, I would honestly say the best bet is just doing a Google search, or also even searching on LinkedIn. There's so many even private groups within LinkedIn that you can find through searching and just kind of clicking around. But if you are also networking with a volunteer or a professional, that's a great way to ask them, hey, do you know of any professional organizations that could be really helpful for my job search? Ask them those types of questions. Are there any certificates or trainings that you would recommend for me to take as a job seeker? So as we're going through this, and you're like, well, I don't know what trainings or certifications, or I don't know what skills to build. These are all questions you can even ask while networking with professionals. And they'd be more than happy to give you deeper understanding of how to find those certificates or trainings, as well as obviously Upperly Global and your job coach can help you too. And so for a call to action, I would love for everyone to join Slack if you haven't yet, and put in a hashtag best tip of how you network. Is there someone who's on this, a job seeker who's listening right now who's a really good networker? Tell us what you do that you think is super successful. Let us know. Let the other job seekers know. Because networking can be a challenge sometimes, but it can also be fun. And so sharing best tips on Slack can be a great way for us to all learn collectively together. And if you need anything from me, always feel free to reach out to me on my email. And thanks so much for listening.
Awesome. So you already heard a lot of tips, advice, informational resources, and you can see that the pathway for a career in global health, public health, and overall, but especially in this area when you have medical background, healthcare background, and you try to switch, or you are already in actively applying for jobs, but you're not getting in an interview. I read a few comments. Ask yourself, like, what can I do differently to make myself more competitive and get the attention for recruiters? So you heard the titles that we presented, examples. Ask yourself, can I tailor my titles? Am I emphasizing the right soft skills, or not only soft skills, but the right skills, knowledge on my resume? And also the experience. It's not enough to just have a wonderful key skill section and professional summary and your experience don't have examples. If you have public health related key skills, professional summary, titles, but your examples and the responsibilities are related to, to your experience as a physician treating patients, this will not be competitive, or this will not show that you are a good candidate for a particular public health opportunity. So ask yourself, like, what can I do differently? Are you tailoring? Are you networking enough? If you tailor your job, if you're tailoring your resume, cover letter, you use the right skills and everything, but you're not networking and you're not following up with a thank you note. You're not connecting with companies. You're not using LinkedIn and reaching out to companies, even if they don't have opportunities listed. If you know which companies you want to, and this is my next two slides. If you create so this is my advice for job seekers. If you are interested, if you in public global health, create a list of companies that you are interested in working with, and then not only those who have opportunities. The reason is that the next step would be to reach out to someone, asking for an information interview, connecting LinkedIn, asking your advisor even if we might have a POC, a point of contact, or even a personal connection there. So be proactive. Don't wait until you will get an interview just to apply. And now to the companies and community employer partners. This is an outline of some companies that we collected that are public global health, but also in nonprofit international development. The first let's start first with PSI International. It's a nonprofit international development organization that works with a lot of malaria and infection disease. And they're currently looking, so it's an employer partner from us. So if you think you're a good fit, reach out, customize your resume, cover letter, please also cover it and reach out to your advisor. But if you can look briefly at the job description, I just want to show you where to focus when you apply for jobs. If we could click on, perfect, thank you so much. So you can see, go to the requirements and ask yourself, like, did I do this? How did I do this? How often? How well? Impact, like if you have treated patients with malaria, try to focus on, like, what are they looking for? How can I transfer my skills and tailor my resume? So just a few important skills that they are looking for to give you, to highlight that you are having those experience, you all, is working experience in developing countries, demonstrated global malaria technical expertise. French is required. So these are just basic short details about a job description that is in public health and that you might be a good candidate, but tailor your skills to it, show that you have done this. Yes. And I don't want to take too much time, but there's FHI 360 as well. We collaborate. It was on the last slide. And don't worry, you are all getting those resources as well. They will be posted on Slack. But just to visualize to you that there are companies in public global health. Just use all the strategies, networking, tailoring your skills, following up, and working with your advisor. Please be proactive. Yeah, that's, I think, it. Oh, this is just a brief summary of community-specific job boards. So you can subscribe. DevX is the most common one, but they're also for monitoring, evaluation, and other STEM biospaces if anyone is interested. So there are more, but this is just the first, first list that we created for you all.
Thank you so much, Patty. So today I am so honored to present an Upwardly Global alumni who is an MD and has also a Master of Public Health. His name is Muhammad Sadiq Hazratze. He goes by Sadiq, and he is currently the Principal Investigator at Public Health Institute. So I'm so honored to present Sadiq, and I will let him take it from here to tell us a little bit more about his journey to get a job, any tips he has, and then we will also allow afterwards for question and answer if you want to enter any questions you have for him in the chat box while he's speaking.
Hi, everyone. Thank you so much for inviting me. It's really a pleasure and honor to speak to this webinar. First of all, this presentation and the information presented, they were very good, very detailed, comprehensive, and basically everything that a job seeker needs, especially in public health and global health. I wish I had seen this presentation when I first came to US, but unfortunately for about 4 to 6 months, I did not know Upwardly Global. And so that's what I want to talk about, my experience, what were the challenges, and what strategies I used to get a job, and how I'm trying to go up the ladder and promote and establish myself. The challenge is, if you are a job seeker, you know what I'm talking about, from being new to the country and applying to different positions, not having a driving license. So it is different from person to person, but it's tough. So I was you 2 years ago, we shouldn't give up, and we should try. We should persevere and work hard. And the strategies that I used, many were explained in very details earlier in the presentation, but I will go through them from a practical or a personal experience point of view. Resume, it was already mentioned, but it's very important when it comes to employment, especially those who call you for interview and hiring. They will go word by word, and there were times that I had missed something, and the employer will call me, or the interviewer will tell me that, did you work with USAID? And I said, yes, this grant was funded by USAID. Oh, I wish this was mentioned in the resume. So make sure that you include everything. That's very important. And cover letter, likewise, it's very important. And LinkedIn profile, it was mentioned earlier. I did not have a LinkedIn profile when I came to US, but I made one, and there were employers. There were times that I was contacted for interview, even the jobs that I did not apply. So employers reached me out, they checked my LinkedIn profile. And it's very important. Even those who call you for interview, they cross-check the LinkedIn profile. Is very important. Networking at the time, there was no pandemic, so I tried not to miss any job fair. I was going almost to everyone. Even they were not for medical field. I remember I once went to a Wells Fargo job fair, even just to meet people, just to connect and share my experience with people, and they were successful. They introduced me to others, and applying to jobs, and if you don't apply, you're not called for interview and you don't get a job. So if you have a resume, cover letter, LinkedIn profile, and have the network, you should apply to as many jobs as you can. And I applied to so many jobs within a few months. And I remember the last month that I was getting my job offer, I had interviews, 3 interviews a day. That there were times that I had so many interviews, and I had 4 job offers the last month that I start working with the Public Health Institute. So the more you apply, the chances, you increase your chances of being selected. And one thing that I noticed was not mentioned in these presentations are state, county, and local jobs. 4 jobs that I had offer in the last month, 2 of them were county jobs. So there are county jobs and state jobs who are looking for skills that many of the international migrants have them. So yeah, well, once you get in the job, the promotion is usually a progress. It's not, we cannot set our goals so high that we will not be able to get them. So start somewhere and then take it from there and progress. My first job was relatively low-ranking position, but within a year, I was credentialed as a principal investigator. In the next year, because of my work and expanding my network, I was offered an affiliation with the UC Davis Department of Public Health Sciences as a visiting professor. So the first time I would have not even dreamed of being there, but starting somewhere and building up will eventually take you there. So I think my time is up, and if you have any question, I'll be happy to answer. Thank you so much.
Thank you. That was, those were really great tips. And now we will open it up for questions. So my colleague Isaac will jump in, but let's see here we go. So how can you, the question from a job seeker is, how can I land an interview in public health? And what steps can I take to get my foot in the door? How would you, any advice you would give for that, Sadiq?
Yeah, so that's a very interesting point, that I had the same thinking and the same feeling at the time. And all the things that I mentioned, that we have to do them all together, from a good resume to a cover letter to networking to applying and building the LinkedIn profile. So all together, they will help you land that job and putting your foot inside the door, and applying to as many jobs. Of course, having a very good resume and checking the vacancy. We should not be applying, of course, to every job, but those which are a very close match to what we can do. So if we see it, we should keep applying, and it does take time, a month or two. It is tough. I was feeling that I might not get a job, but I found that there are so many people who are happy to help us, thousands and hundreds of thousands of people, and there are hundreds of companies who are looking for someone just like us.
Thank you. And last question, do you have any networking tips you could share?
Yeah, so at the time there wasn't pandemic. I'm sure now you might have different strategies with the social distancing, but at the time I was visiting all job fairs, meeting people, and I remember once I went to a job fair and introduced myself to someone who was not involved in public health, and his company was not working in healthcare. I just talked to him, and we had a few minutes of chat, and I shared my business card. I told him, look, you are not involved in public health and healthcare, but you might know someone who is, and that person introduced me to someone, and that someone introduced me to another person, and they interviewed me for a job. So we should be we shouldn't be shy. We should meet people and expand our network. And LinkedIn is very good right now, virtually connecting. So, so my bottom line is don't be shy and talk to people and share your story. There are a lot of people who will be interested in your story.
Thank you so much. That was incredibly inspirational. And for all attendees, Sadiq has also generously offered that, or said it was okay if I shared his LinkedIn profile with you all. So when we follow up with you tomorrow with the presentation PowerPoint, as well as the recording of this webinar, we will also include a link to his profile. So thank you so much again. It was truly an honor to have you here with us.
It was my pleasure, Leila, and I will be happy to help and share my story with and tips that I know with others.
Thank you. So we are going to end on the note of our new community Slack. So for those of you who already joined, you're probably a little familiar with it, but just to give you a sense, Slack is a computer or phone application. And we have opened this up recently to all job seekers at Upwardly Global to have job seeker to job seeker communication and also group communication. So I am going to share the Slack app with you to just kind of show you a bit about Slack. Let's see here. Okay, and let me just show you the Slack app. And we have just launched our public and global health channel just today in time for this webinar. So here are all the channels. And when I say channel, that means group chat. So you can see general, the I'm new, please introduce yourself, language corner, you can chat in different languages, opportunities, residency for those of you who are pursuing that. And here we have public and global health. So if you haven't already joined Slack, please join and you can check out all the resources that we have for public and global health. We've posted quite a few of the ones mentioned in today's webinar. So check that out here. If you have any questions about Slack or how to join, contact your UpGlo advisor. We're so excited to have this new forum where you can do group chat and you can also do direct messages as well. So now we are going to open it up to any questions. So I will stop sharing my screen. And if you had any questions that you've already asked, we'll start by answering those. Okay, so let's see if we had any questions in the chat box. And if you have any questions for us, the Upwardly Global Job Advisors, please enter them now as well in the chat box.
Hi, Leila. It looks like there's a question in the chat box asking if they have experience in public health, but not a certification. Do they need to get a certification before applying?
That's a great question. I'll start out and then I'll open it up to any of the other UpGlo Health Care team members. But there are some options in public and global health that don't require certifications at all. So contact tracer is one. We recommend doing the free Johns Hopkins Coursera course, totally online, short course, to get a online certificate. It's like I said, very short course, but it's not even required for most contact tracer roles. Another role that comes to mind is the community health worker, where you can utilize your multilingual language abilities, and especially if you live in like an immigrant hub, to work directly with community members. A lot of those roles don't require certification. Some of them may hire you and support you while you're earning the certification as well. So those are a couple great options. Tamar, Patty, Kayla, Sarah, Isaac, anyone have anything else they'd like to mention?
I think you hit some good ones, Layla. I would certainly say to explore the resources that we shared today and think, and I'm happy to talk. I know all the coaches are happy to talk if to you as job seekers of people who've been in the program. Maybe we haven't even thought about you as folks going a more public or global health route. So let's start those conversations and move them forward.
Great. And we have another question here. How can we get the links to any job fairs that are specific to public and global health?
I think the most important thing in terms of that is joining local public health organizations. There's the American Public Health Association, and related to that are local, state, and other. I will share a link.
Thank you, Tamar. Anyone want to add to that as well?
So here's Patty. Hi. So we will also try our best to either share via email or now Slack. So just check your emails and follow up with us. Also, if you have attended a job fair, so we can help you to follow up, how to follow up with someone. We'll remind you of contacting and connecting people. So just attending job fairs is one part, but the steps afterwards, there's this. It's a continuous process. So just make sure that you all keep us in the loop and check Slack and follow up with us. Be proactive, please.
Thanks, Patty. I don't see any further questions in the chat box, and I think since we're at time, this is a great place to end. So on behalf of all of us at UpGlo, thank you so much for joining us today. And as I mentioned earlier, we'll be sharing the Slack invitation with you if you haven't already joined, the PowerPoint presentation, the recording of this webinar, and Sadiq's LinkedIn profile URL with you tomorrow. So you can have all of these resources, and please contact your advisor if you have any questions.
Thanks, everyone. It's been great to connect. Stay tuned. We'll be doing more webinars to come.
Thank you, everyone. Thank you.